This chapter covers teaming and its relevance to primary care teams. Here are today's learning objectives. Firstly, we will cover what a team is and the difference between real teams and pseudo teams. We will then describe the concept of teaming and recognise the benefits of effective teaming for primary care teams. We will then reflect on what this means as the NHS is evolving. Finally, we will explore what we need to do as educators to develop effective teaming skills in our learners. Before continuing, let's pause to consider what is a team as opposed to a group of individuals. A group of people is not necessarily a team. A group is a collection of individuals working towards their own goals with individual accountability. According to author John Katzenbach, a team is a small number of people with complementary skills who are committed to a common purpose, set of performance goals, and a shared approach for which they hold each other mutually accountable. An example might be a women's basketball team regularly meeting to practice their skills, to try to improve their collective performance and increase the number of successful shots in the opposing team's hoops, while preventing the opposing team from scoring. What about NHS teams? Professor Michael West has done extensive research in the UK, both in commercial companies and the UK National Health Service. He developed 3 simple questions for ascertaining the difference between real teams and what he terms pseudo teams. 1. Do you have a few clear objectives that you need to achieve as a team? 2. Do you work together to achieve these team objectives? And 3. Do you meet regularly to review progress and how it can be improved? In his research on the NHS, he found that around 91% of the total groups studied said they worked in teams. However, only 40% could answer yes to all 3 of these questions. He and his colleagues went on to compare the 40% who worked in real teams with the 50% who worked in what they termed pseudo teams, and found that those in real teams not only had much greater work satisfaction, but also better clinical performance, patient satisfaction, health and safety records, less turnover and staff absenteeism, and lower patient mortality. Clearly, effective teamwork is critical for both staff and patients. Take a moment, pausing the presentation if needed, to consider your own workplace and whether you are working in a real team or a pseudo team. See if you can answer Michael West's 3 questions about your own team environment. If you have answered no to any of these questions, how could you make changes to ensure you're working in a real team with all the benefits discussed on the previous slide? Primary care teams are more diverse than ever with the introduction of new allied health professional roles working across primary care networks. Complex patients with multiple lung conditions require input from a broad array of specialities and community teams. As the cartoon shows, we cannot work in silos. We cannot use workload and busyness as an excuse. We must collaborate effectively and work together to drive quality improvement, particularly in the challenging, complex, ever-changing NHS environment. Why is effective teamwork so vital for effective patient care? Caring for a diverse, ageing population with multimorbidity is increasingly complex, and we cannot be an expert on everything. Multiple sources of expertise spanning different professional roles are needed for safe, quality care. It's not just who is on the team that matters, but how effectively we collaborate. Where care is not well coordinated and team members are not communicating effectively, then patients experience episodic reactive care of individual health issues. This leads to fragmented, inefficient care, and the patient at the centre experiences duplication and confusion. There is now a drive for more integrated, coordinated, holistic approach to managing a patient's health proactively. Emphasis is placed on the patient at the centre, with all aspects of their care, physical, mental, and social, aligning around their individual needs and preferences. Team working across neighbourhoods is fundamental to the future of general practice, according to the government's new 10-year plan for the NHS. Practices have already come together at scale in primary care networks, with new roles being introduced, creating multidisciplinary and multi-agency teams. This is about to become even more complex with the advent of integrated neighbourhood teams. Here, a variety of sectors, including primary care, community services, social care, and the voluntary sector, will collaborate to deliver joined-up, holistic care for a specific local population. This approach, recommended by reports like the Fuller Stocktake, aims to improve access to services, promote preventative care, reduce duplication, and tackle health inequalities by addressing the wider determinants of health within a community. Making these teams function effectively will be a complex task, and effective teaming will be essential. In our basketball team example earlier, we had a consistent group of players who regularly trained together and over time develop trust and learn each other's strengths and weaknesses with the aim of improving performance. In the NHS, we don't always have the luxury of working in a stable, fixed team. Individuals with diverse backgrounds and expertise must regularly come together in flexible, temporary teams to support patient care. Teaming is a verb described by Amy Edmondson as teamwork on the fly. It's the dynamic process of collaborating effectively across knowledge boundaries to achieve a common goal. So, how can we encourage the dynamic collaboration of teaming that enables learning and innovation, particularly in temporary or fluid groups, so they can adapt to the complex situations of NHS healthcare? Amy Edmondson describes 3 core elements for effective teaming. The first is shared purpose. This is the collective why that aligns team members, giving meaning and direction to their work. It provides clarity and motivation, helping diverse individuals focus their efforts towards a common goal. The second is empathy. This is the ability to understand and share the feelings and perspectives of others. In teaming, this means actively listening to colleagues, appreciating their unique contributions, and fostering mutual respect and trust. Lastly, psychological safety. This is the belief that a team is a safe environment for speaking up, asking questions, or admitting mistakes, without fear of punishment or embarrassment. In primary care, teaming is essential. Effective collaboration, particularly for complex patients with long-term conditions, improves patient outcomes and reduces errors. Teaming allows for care plans that address a patient's medical, psychological, and social needs, making the patient feel more involved and empowered in their own health journey. In effective teaming, care is better coordinated and more efficient, reducing unnecessary duplication of work. Patients can be directed to the most appropriate professional for their needs, improving access and shortening waiting times. Strong collaboration across organisational boundaries can also improve integrated care, connecting primary care with community, social or voluntary services. Diverse teams with high psychological safety are more creative and resilient, leading to innovative approaches to care delivery. Clinician well-being is also supported when teams are more engaged. Sharing responsibilities within a team distributes workload and reduces the pressure on individual providers, which can improve job satisfaction and morale. Individuals can learn from one another's expertise, leading to shared knowledge, improved clinical skills, and a deeper understanding of other roles. A supportive, collaborative work culture with a sense of shared purpose can also promote well-being and improve staff retention. Now, I want you to consider your own role as an educator and how you can support our future workforce to develop teaming skills. What core skills do learners need to develop to be able to effectively team? What teaching methods can we use to help develop these skills? Pause the recording and restart when you're ready to continue. What skills did you come up with? Here are a few suggestions. Firstly, active listening, paying full attention to understand a colleague's perspective without interruption or judgment. Clear language, communicating in terms that everyone can understand, avoiding discipline-specific jargon. Verbal and non-verbal awareness, using appropriate tone, body languages, and gestures to convey respect and openness in the team. Mutual respect and trust, viewing each team member as a respected colleague and valuing their unique skills and perspectives they bring. Psychological safety, contributing to an environment where team members feel safe to speak up, ask questions, or admit mistakes without fear of retribution. Role clarification, understanding one's own role, as well as the roles, scopes of practice and expertise of other team members. Flexibility and adaptability, being able to shift between leader and follower roles depending on the specific patient case or situation. Having a shared purpose, working together towards a shared patient-centered mission. Consensus building, engaging in discussions to find a mutually agreed upon solution that synthesizes various ideas. Empowering others, encouraging team members to participate openly and suggest solutions. Having a problem-focused attitude so they can address the problem at hand. Empathy and mutuality, seeking to understand another's perspective and acknowledging their concerns. Systems thinking, comprehending the larger context of healthcare, including social determinants of health and health inequalities. A commitment to quality improvement, using data to identify system errors and implement solutions to improve patient care quality. And lastly, reflective practice, regularly reflecting on team processes to identify successes and opportunities for improvement. You may have come up with several others. What strategies did you come up with to develop the teaming skills we just discussed in your learners? Here are some examples of possible strategies you could try, but this list is by no means exhaustive. Pause to consider the list and reflect on what you're already doing and whether there is anything new you might try. To end, we have a suggested exercise which you could run in your own practice team to discuss how to create a psychologically safe environment for the whole team. There'll now follow some instructions on how to run the exercise. Firstly, ensure the whole team is invited, including all multi-professional clinical and non-clinical staff. Draw a large circle on a whiteboard and write the word in inside the circle and out outside the circle. Set the scene with psychological safety as a shared belief that it is safe to discuss ideas, experiment, take risks, give feedback, and learn from mistakes. Psychological safety is key to an inclusive team culture. Everyone has a part to play in the psychological safety of the group, and this is the opportunity to state what behaviours we need. Ask participants to add examples of behaviours or conditions that the team needs to see or feel for a safe psychological space. And then outside the circle, add behaviours and conditions that work against psychological safety. You could use sticky notes for anonymity. Demonstrate by writing, "We all trust each other," inside the circle. Once all team members have contributed their ideas or post-it notes, take a few minutes for everyone to review all the inputs. Once completing the exercise, ask the team to discuss how can we make sure that everyone does what is inside the circle and avoids the behaviours outside of the circle. Identify and address any barriers to psychological safety in the team. You could create a list of concrete behaviours which the team all agrees to. Reflect as a group on how the team will hold each other accountable. Psychological safety is one of the most significant ingredients in successful teaming. Amy Edmondson described psychological safety as a shared belief that the team is safe for interpersonal risk-taking. It's critical for effective teaming. A multi-year study conducted by Google, named Project Aristotle, was designed to determine what makes a team effective. The project initially hypothesized that the most effective teams would be made up of the best and brightest individuals. However, this assumption was proven incorrect, with the single most important factor for high-performing teams being psychological safety. Who was on the team mattered far less than how the team interacted. Fostering a psychologically safe and respectful team environment is the most critical element for success for team performance. Please see our Supervision Toolkit chapter on psychological safety to explore this in more detail. In summary, we hope you've taken away that teaming is not automatic. It's a skill which we can develop in our learners and in ourselves. Primary care is dynamic, requiring teamwork on the fly, where fluid groups come together for the purpose of excellent patient care. Psychological safety, empathy, and a shared purpose can foster effective collaboration in teams. As educators, we can model and teach teaming skills and behaviours to support our learners in navigating the challenge of working across boundaries within our ever-evolving NHS. For a final takeaway, reflect on what is one thing you have taken away from today's session. What might you want to revisit or explore in more detail? And finally, what might you do differently as a result of today's learning? If you are interested in reading some more around teaming, have a look through the attached references which have been used to create this chapter.